I've had sleep apnea most of my life, probably 60 years.
I would sense that his diaphragm was trying to work, but he wasn't breathing. And then I would have to give him just a little nudge in order for him to, and then he would gasp, and it was awful. It kept me awake a lot. Just waiting for the next episode to happen.
Well, then I tried the machine, and I gave it 3 months. My best friend and wife here said, why don't you go ahead and try it some more? I said, why don't you try it? And she did. And it lasted about how many minutes?
Maybe 15 seconds.
And
I yanked that thing off.
He said, well, we take out the excess material that's in your neck on the inside, uvula, and move your tongue forward. I said, I don't think so. And he said, well, you'll die. I said, well, I think it'd be a better way to go than that. It's just very easy to put in.
I sleep better.
Okay.
Your blood pressure has gone down significantly.
If I get in a car and drive after a meal, I'd fall asleep. And I don't do that anymore.
No, I just would keep saying,
Your
are you
eyebrows
doing okay? Are you doing okay?
Up to your hairline.
He would try to keep his eyelids open, and so his eyebrows would be up in his hairline. Oh, it would clear up.
How am I doing now? And I stay awake.
He does. We have a life after dinner.
Yeah.
That's right.
Snoring is more than a laughing matter. It may be a symptom of a serious condition called obstructive sleep apnea. Other signs of sleep apnea may include stopped breathing while sleeping, high blood pressure, weight gain, waking up tired, dozing off while driving, gastric reflux, diabetes, and even depression. According to a report from the National Commission on Sleep Disorders Research, nearly 20 million people have sleep apnea, a breathing disorder that disrupts sleep and makes waking hours miserable.
I've struggled with sleep apnea for probably 35 years at least. You know, we tried a lot of things. We went from strips on the nose to salves to great discussions with my pastor. He recommended that we do a sleep test. When those results came back, he said, "You've got a problem." He said, "I think we can fix it." Now, being a surgeon, he obviously would recommend surgery, which he did on my throat, taking out what was considered unnecessary parts. I was in absolute agony for the better part of 6 months. Then we went to what is known as a CPAP machine, and by the way, I've gone through 2 of these things. This little device is what I put into my mouth each night. It's very convenient. The very day that I brought this home and went to sleep, I had a different kind of sleep than I did with the CPAP machine that I've been using for 15 years. I have not snored using this device, and I've used it for over 2 years. If my wife was here, she would probably be standing right behind me and clapping her hands in regards to how she feels these days without being tired herself and without having to put up with this nonsense of sleep apnea. But from my perspective, this is a can't-fail device that has impacted my life and my wife probably more than any other single thing in the last 15 to 20 years.
Sleep apnea literally means without breath. It is when breathing stops for 10 seconds or more while sleeping. Sleep is a basic necessity of life, but even more important is breathing. When you sleep, air travels through your nose and mouth, down the throat, and into your lungs. The narrowest part of the airway is at the junction where the soft palate, the tongue, and the back of the throat all compete for the same space. When you are awake, the muscles are tight, keeping the airway open. But when you sleep, these same muscles relax, causing the airway to narrow. As the air passes through the narrowed opening, the uvula and the surrounding tissues begin to vibrate, causing a condition known as snoring. If the tongue continues to fall back, it will cause the breathing to become slowed or completely stopped. This is known as obstructive sleep apnea. Sleep apnea can cause fragmented sleep, shorter lifespan, reduced quality of life, and even death. A comfortable and effective option for treating obstructive sleep apnea is with a custom-made, removable sleep appliance that a dentist trained in the treatment of sleep apnea can provide. With the sleep appliance in place, the lower jaw is prevented from falling back, keeping the tongue forward and the airway open. Often this will reduce or eliminate snoring and sleep apnea, providing the body with deep, restful sleep. People suffering with sleep apnea often experience headaches from what is called hypoxemia. That's a lack of oxygen and a buildup of carbon dioxide. Sometimes headaches are also caused from a misalignment of the jaw, pulling muscles out of position and causing a condition known as temporal mandibular joint disorder, or TMD. When the facial muscles accommodate for a poorly positioned jaw, it can bring chronic facial fatigue, causing headaches, achiness behind the eyes, ringing in the ears, a stiff neck, and tightness in the upper back. This was the case with Alicia.
I have had headaches, particularly migraines, for as long as I can remember, ever since I was a little kid. My son is 12, and all he's ever known is, Mom's gonna have a headache, and she could have this headache for 2, 3, 4, 15 days. If they make a drug and market it as a headache treatment, and some drugs that aren't marketed as headache treatments, I have probably tried it, including receiving Botox injections every 6 months. I've had nerves in my neck blocked by radio frequency, antipsychotic meds, Benadryl, you name it, I've probably tried it. I missed school events, I missed athletic events, I missed family get-togethers. I would get angry faster, I would lose patience faster. My husband had to pick up more of the slack. And I came upon, the studies. One said, go have a forehead lift and get your head, the muscles in your forehead cut. And the other said, go to your dentist and see if you have TMJ and or sleep apnea. And I chose the dentist. And I was ready to just sob in relief because finally somebody was giving me an answer, and it sounded more promising than any medication I have taken. Since treatment for sleep apnea and TMD, I have completely eliminated all of my headache medications. Now I sleep better, I feel better, I'm not missing out on family events. I can't stress enough that if you've tried everything else and nothing works, really, what do you have to lose? Go check it out, because it probably is the key to what's bothering you.
Sleep apnea affects every aspect of living: social life, family life, personal happiness. It fragments our sleep, affecting careers and even inhibiting professional success. Untreated sleep apnea can reduce lifespan by 7 to 15 years. The best news? If you have sleep apnea, you don't have to keep suffering. You can receive treatment and just skip it. In 2006, the Academy of Sleep Medicine issued an official statement that a dental appliance can be used as the first line of treatment for mild and moderate sleep apnea, and as an alternative to the CPAP for severe sleep apnea for those who are CPAP intolerant. The Academy of Sleep Medicine reports oral appliances are the #1 non-surgical alternative for CPAP intolerance. The CPAP works by using positive airway pressure to force the blocked airway to open. The dental appliance works by holding the jaw forward and not allowing the airway to close in the first place.
I had had a sleep study and indicated that I was waking up somewhere between 30 and 40 times an hour. My doctor gave me the option of a CPAP, which I decided I didn't want to do. I had tried one at the end of the study and I just didn't want to really mess with it per se, but the apnea kept getting worse. The snoring was getting way worse. I would actually have what I called suffocation dreams. I knew I was dreaming and I would try to tell myself to wake up, but I couldn't wake and I couldn't take a breath in. I would just bolt straight up in the middle of the night and take this tremendous gasp of air, and my heart would just be pounding and racing, and some of these dreams were pretty disturbing. My wife actually saw an article or an advertisement in the local paper about a presentation that was going to be given by a local dentist and was talking about this appliance that you could wear in lieu of the CPAP machine, and so then I went ahead and made the appointment and had the evaluation, and the doctor said that I was definitely a candidate. The very first night that I wore the appliance, according to my wife, I quit snoring. As long as I wear the appliance when I fall asleep, I do not snore. And it might have taken me personally only 2 or 3, 4 nights to get used to it. I've got a little carrying case for it, so it's real portable when I go places, vacations or trips. I just put it in its little carrying case, put it in my suitcase, and away I go. It's really been just an incredible 180-degree turnabout.
Oral appliances are comfortable and in almost all cases greatly reduce or completely eliminate snoring. Treatment with an oral appliance is reversible and non-invasive. Oral appliances are small and convenient. This makes them easy to carry when traveling.
I wasn't aware of that I had sleep apnea until I went into atrial fib. And it's a serious condition, and I went to the emergency room because I could tell there was something wrong. While I was there, the doctor said, "Have you ever been tested for sleep apnea?" And I said, "No, but I will be honest, I have noticed that I've been waking with headaches in the morning for some time." After I was diagnosed with sleep apnea, I went to the pulmonologist and said, "Is it possible? I've seen that the FDA has approved a dental appliance that can treat sleep apnea. Am I a candidate for that?" And he said he would check my chart, and he did, and he came in and said, "Yes." Well, since I've been using the oral appliance, I've seen many differences. I don't wake up in the morning anymore with headaches. When I am up, I have so much more energy. I'm not falling asleep in the chair in the middle of a television show. When I'm going on a trip, I'm not riding along in the car and missing all the scenery because I don't fall asleep in the car anymore. And I don't get up in the middle of the night to go to the bathroom like I did before. And I haven't had any AFib since my appliance corrected my sleep apnea. All these things have really made a change in my quality of life. And I can't say enough about what this oral appliance, which is so easy to wear, has done for me.
I struggled to stay awake at work. I fell asleep at the wheel. My doctor referred me for a sleep study. The mode of operation was to just continually raise the pressure in that sleep study with the CPAP machine, and it was unbearable. A week or two later, we were invited to a seminar that our dentist provided, and my wife nudged me and said, "Doug, that's you." The dentist at the seminar, he encouraged me to see a specific sleep doctor that he had worked with, and he gave me good news. He says, "Doug, I can tell from your sleep studies that you left very frustrated." And he says, "I have good news for you. With your very severe apnea, I believe that we can make this bearable for you by decreasing the pressure of the CPAP machine and accomplishing what we need to do for you with the oral device." It has worked very, very well for me. My wife gets more rest. I don't fall asleep at work. I don't fall asleep behind the wheel. My blood pressure has come down some with this combined therapy. My energy has definitely increased. All of our family members in our home, and we have a large family, have commented My goodness, Dad doesn't snore anymore. Dad's not falling asleep when we watch a movie together. Dad's not falling asleep as he's driving. Another thing, I had to get up every night and go to the bathroom during the night. And I know why, is because I did not get a deep sleep. I never got a deep, sound sleep, and now I do. I believe that a risk of heart attack or just dying in my sleep because of my severe apnea is greatly reduced now. And so I anticipate years of watching my kids grow up and watching my grandchildren.
The professionals in this office are trained and ready to assist you with a dental oral appliance today. Just say, skip it, and they will handle the rest. Skip the snoring, skip the headaches, skip the daytime naps. Why not make today the day that you choose to skip it?